Okay, so this is a little last minute. I planned on filming this over the weekend, but there was a lot of things that needed to get done, some analyses I needed to run. Also, a very wonderful chat with the amazingly intelligent, wonderful mentor, Megan Srinivas. That was yesterday. Um, but I thought that it was really important. So now we're well into exponential growth. Not just here in Iowa or in our region, Region 7, or in even the Midwest, but nationwide. And we can see that when looking at the daily positives, how we are now seeing, like we were seeing a decrease. We were on the down slope, and now we're on the up slope. So what we have here is basically a parabolic curve. Down here at my wrists, that was when we had the lowest amount of spread. But heading up toward my fingers on either side, that's when there are higher and higher positives. And as we get more positives every day, those positives are going to continue infecting anywhere from 5 to 8 people, provided they're unmasked or in any other way unmitigated through vaccination. We should expect numbers to get really big really fast now. Originally, it was just a few more positives every day, but we're heading north, and that's a problem. So what I wanted to show you guys with regard to Iowa, and I have my own county selected. Story County is now in high transmission. We have a lower vaccination rate than Johnson County. That's my home county and my mom lives. But we're close enough to, say, Webster and Hamilton. So the positives there are starting to bleed out. And if we look at my heat map from last week, this was based on last Wednesday's data. There were some really concerning counties, Humboldt, Hamilton, Franklin, Adair, and Monroe, but all the rest of the counties had increasing transmission, but it wasn't so large that it was super concerning. It was somewhere in the lower to moderate risk category. But highest risk is transmission of more than like 200 people out of every 100,000 that were getting sick every 7 days. And if we look at the CDC's map, and I don't have all of this data because IDPH hasn't released it yet, and CDC hasn't fully released it yet. They have it visualized, but they don't have it in a data set. We've got a lot of counties, northwest, north, south and southeast, southwest as well. They're starting to light up. And I want to make this clear, the counties that are blue are not necessarily safe. If you see a blue county, a low transmission county, right next to a high transmission county, it probably means that the testing is either gate kept for one reason or another. It is lackluster. People aren't wanting to go get tested. So we can't really trust when a county is blue. And the reason I say this, I'm going to zoom out. If we look at the whole region, and our region is 7, which is Nebraska, Iowa, Kansas, Missouri. Almost all of Missouri is deep red. A good portion of eastern Kansas is deep red. And Nebraska doesn't share their data. So you can't trust Nebraska. Missouri is a disaster. And a lot of the counties on the Missouri border here in Iowa are also high transmission. It means that much of our state isn't safe. And that segues naturally into the fact that today the CDC is recommending that vaccinated persons mask back up. Now, I know a lot of us never even stopped masking. God knows I didn't. I never will. But we have high transmission in many, many parts of the country. And when there's that much transmission, when there's that much virus out in the community, and we don't have vaccination rates anywhere we need them, like we needed 80% or higher of every single available person vaccinated, and we're nationwide, we're around 50, I think 51% today. Statewide, we're in the 46% range. Again, I'll know more with tomorrow's data, but we're nowhere near where we need to be in order to slow Delta with vaccinations alone. We need to be using non-pharmaceutical interventions, masking, socially distancing, not hanging out with vaccinated or unvaccinated persons without your mask on, staying home as much as possible, especially if you're in a moderate or high risk county. It means we need to go back to using all of those mitigation measures we were using before the vaccines existed, because we're heading well into the next wave. And I was looking at Twitter, and I'm going to come over here. That's the HHS data set, Sarah. I'm going to come over here, and I'm going to go to Dr. Topol's feed, because he posted a graph of Louisiana itself today. I just got to find it. This is Louisiana right now. In 1 to 2 days, they are going to top their height, the apex of their winter wave. And that's really concerning from my perspective, because if we look at the top of our wave, we had about 60,000 people actively infected. That's the top of our wave. That's bad, because that's when we were having days of, like, whole weeks of deaths, 300 to 400 people dying every week. And that's a big problem, because we are absolutely heading back upward. I see it in the data every single day. It's interesting because the pattern is showing up more strongly in antigen tests, but there are also more antigen tests done because those are done they're easy to access, they're done in long-term care facilities, and if we're seeing increasing testing with increasing positivity rates, it's going to get bad fast. I don't want it to get bad fast, and the best way we can do that is by using every single mitigation measure available to us. And when I come to that part, this is region 7. This is the different variants that have existed since March for our region. Again, Iowa, Kansas, Missouri, and Nebraska. We need to assume that every single positive we're looking at is Delta. That's it. And it's been Delta now for a few weeks, because this is only through 7/17 and today's the 27th. Delta is it's a variant that's a lot different than the other ones because it transmits so much faster. Alpha's transmission was 3 to 5 people with no mitigation measures involved, whereas Delta is 5 to 8. That's in the realm of smallpox. Not quite measles, but definitely heading that direction. If we use every measure available to us, masking, social distancing, staying away from unvaccinated persons, not being in congregate public spaces for very long, and keeping the mask on in them, we can pull that transmission rate down. And recent literature has suggested that we could pull it down to maybe 1.4. That is still more than what Alpha was able to be pulled down from. Because with mitigation measures alone, Alpha pulled down to around 1. But any rate of transmission that's above 1 means exponential growth. We got to pull it down as much as we possibly can to save as many lives as we possibly can. I know that a lot of us who've gotten vaccinated, we're starting to get frustrated at the people who don't want to vaccinate, the people who just willingly walk toward either their death, their kid's death, their grandparents' death, because they don't think it's going to happen to them, because throughout much of the pandemic, it hasn't really happened to them. They've been insulated for one reason or another. This wave is going to be different than all the ones before because it hits hard and it hits fast. And I can show you what it looks like, what it's looked like in other countries, specifically the UK and Netherlands. Those are the best examples that I have. This is the daily new cases. And what happened was they had low spread for quite a few months, just like we did. And then Delta came out of nowhere and just took off like crazy. And what happened in that period of time, they had lockdowns, they had masks, they had vaccinations, they had everything, and it was still growing exponentially. It's almost as if the virus it's transmitting pretty quickly, and it's finding special ways to transmit. When people take off their mask to eat lunch, when people take off their mask to gather in an outdoor space, all of these areas where you take your mask off because you think, oh, it's a few minutes, it's safe. It's not necessarily safe. Vaccinated positives are still more rare than unvaccinated positives. And I think the reason might be is that we're not testing enough for vaccinated people. Um, the people who are vaccinated and become symptomatic, we're testing for them, but we're not necessarily testing for the asymptomatic ones. And we may not, just as with every other wave, we're probably not going to find every single positive. Positivity rates, like last week, were indicating that we weren't finding everybody anyway. Because if positivity is increasing with lower testing availability, that means a larger share of whatever tests we did are positive. That means that more people are symptomatic, more people are getting tested, and maybe not everybody is getting tested. If we had enough testing to show that our test positivity rate was around 1% or lower, chances are we'd be finding everybody. But that's not where we're at. PCR positivity of 4.62, we're missing at least 50% of our people. Testing wasn't finding them all. And with a more transmissible variant, not enough testing means there are people wandering around our communities potentially unmasked, either knowingly or unknowingly infected, and they're transmitting it. It's one of the reasons that Delta spreads so well. It's faster, it produces 1,000 times the viral load, symptoms show up earlier. The virus is learning how to become better at infecting us and infecting a lot of us. So if I can give one big takeaway, mask up, vaccinate, wash your hands, stay away from people as much as you possibly can, keep distance in between each other, lobby for workplaces to mandate masks in the business, mandate vaccinations in the business, because yesterday the DOJ said that individual businesses can mandate it and they can fire employees who don't follow that mandate. Put the pressure on the people you know that you care about who either aren't vaccinated or are on the fence. Get them vaccinated, because the more people we have that are vaccinated, that are protected, the better it's going to go for all of us. That's the takeaway here. Stay safe, mask up. I'm probably going to be doing more of these because we're heading into another wave, and that's what I did in the last wave.